anniversary of the Florence Nightingale in 2020, and we took up this collected the evidence globally, the best practices of the nurses in the globally, and took it to the International Council for Nurses and the WHO. So WHO you all know that every year in the month of May, the World Health Organization celebrates the World Health Assembly, in which 190 countries health ministers, 190 countries the directors, and 190 countries secretaries participate in this every year. They discuss the global trends and comes out with a resolution for the countries to implement. You know how the WHO, but the first time WHO has not recognized any other human resource except the nurses and midwives. In 2020, they declared in the World Health Assembly International Year of the Nurse and Midwife. They have not done any other category. That itself shows how World Health Organization recognized the roles of the nurses and midwives in 2020. Unfortunately, we could not celebrate the euphoria of that the celebration because of the COVID. But COVID gave an opportunity for demonstrating how nurses and midwives are making an impact and outcome in the healthcare delivery system. The globe has realized, even India has realized the roles of the nurses and midwives in COVID. So they also came out in 2020 that State of the World Nursing Report, that's called SON and SOMI State of the Midwife Report. The World Health Organization has come out with the resolutions, and that report constituted 4 themes. Very important, at least for me working in Government of India, these themes are music to ears to me. Because the first is they are telling to the countries, you have to invest more money in nursing. I think WHO is telling to the countries, you have to invest more money for the nursing and midwifery. That the first theme was woven in that report. If you go through that report, I always tell many of the educators, nursing educators and the planners, it is available in the IMC website. Please go through that, read the line by line, whole report, how it has been captured, the evidence-based nurse practice of the globally which is available. The first theme is investment. The second thing again is the music to ears to me, because while working in the Ministry of Health, achieving the nurse-patient ratio norm is one of the challenge for us, because whatever the norm, staff inspection unit norm, what the Government of India has given, still we are not able to implement that, the SIU norms. Still many of the states, except some of the central government institutions, they have achieved the norm of the SIU norms. Whereas many of the institutions, they have not yet, many state governments have not yet implemented the SIU norms. Therefore, this World Health Organization is telling to the countries, please create the post. Not only training is not going to be sufficient, you have to create the post as per those countries' nursing staffing norm, which is one of the challenge in India, because all the state governments will tell, due to the financial constraints, we are not able to implement the nursing staffing norm. So that's one of the big challenge, which the globe has addressed to all the countries, creation of the position. The leadership, there is an evidence which is available. A nurse is working for the patient, which is she the custodian of the patient, and where the interprofessional experts and consultants will be attending the patient, whereas there is an evidence is available, if the staff nurse and the nursing superintendent, all those people are trained in the leadership, the impact and outcomes are going to be more. This is an evidence which is available. So therefore, the WHO is telling to all the countries, there is a need to give the leadership training to the nursing professionals in different categories. So in that perspective, at least Indian Nursing Council has taken a lead of getting one of the leadership for change program, which is operated in the 40 countries. It's a branded LFC program. The leadership for change program we brought into India. We have trained. It's a very expensive field. We have to pay to the ICN. Even then, Indian Nursing Council paid that. We have trained the 40 people now in the leadership for change. This is not a regular simple training. The training is if a nurse working in a ward, if the infection is there, how the infection can be reduced There is no theory on the leadership criteria and all those are not taught in that. The change, what change is required, that is given in that leadership or change training program, which you have brought to India now, and this is going to be rolled out in all over India, so that we want to train as many as nursing professionals, so that the leadership skills are going to make an impact and outcome. Service delivery, which is very important, the working conditions of the nurses, the supplies and equipment which are required for the nurses and midwives to work effectively. So all those are the regulatory reforms, the safety and security, all those things which are covered in the service delivery. So they are telling to the countries, you have to take care of the service delivery component. So these four important resolutions, they formed, they are not only announced it, they brought it in the name of the Strategic Direction for Nursing and Midwifery, STNM 21-25. WHO works 4-year cycle period. So in the 4-year cycle, they have said with all the WHO reasons to work with the countries that to implement these resolutions. So they now, because the 2030 is one of the deadline for the universal health coverage of the United Nations. India is also signatory to the United Nations for achieving the universal health coverage. So therefore, now the WHO has taken extended that achieving this STNM resolution by 25 to 30, because that 2030 is the deadline for achieving the universal health coverage. So therefore, they have given another 4-year time to all the countries to achieve the STNM resolutions. I think coming to this is India is we have made a very good quantification of expansion of the nursing educational institutions in India, but quality is a concern. I think Indian Nursing Council is closely watching and taking various measures to improve the quality of the nursing education. As I said, we have gone with the quantification of expansion. Now for us, is the quality is a concern. See, I think now the advancement of nursing practice, excellence and all what this conference is focusing on, the Indian Nursing Council initiative. I think one of the problems with the due respect to the medical fraternity which are here, I think the word while I was working in the Nirman Pune as a nursing advisor, I was not able to implement the nurse practitioner program. This some of the medical people, they are not pro for the nurse practitioner program. I used to tell many of the consultants, developed countries, they are very comfortable to work with the developed countries with the nurse practitioner as a very important team. But when they come back to India, they don't bat for us. So that is the problem. I think we experienced it and we have done a lot of lobbying. And I think I have to request to in one of the meeting to Devi Shetty ji. So Devi Shetty will take an initiative to talk to our health minister and I think 2016 and that make an impact and the government of India was willing to discuss and I think Indian Nursing Council took a lot of initiative at the level of the Union and Secretary. This issue was discussed and the Ministry of Health when the proposal was sent to the Ministry of Health with the nurse practitioner critical care program, they told me, you as a president, you have empowered to prescribe the syllabus for various category of nursing professionals. Why do you have come to the Ministry of Health? So then I have to tell literally to the Joint Secretary, sir, India में कोई भी चीज नया चीज रोल आउट करना है, Ministry of Health का टप्पा से it will not be possible to implement. So this is the literally have to tell my Joint Secretary at that time. That made a lot of significant impact and at the level of the Union and Secretary, they were able to approve the nurse practitioner critical care program. Though we had a nurse practitioner midwifery program which we started in India, but somehow or the other it was still on in the global definition of the nurse practitioner, it has to be a postgraduate 2-year residency. I think which is one of the big sea change in implementation of the nurse practitioner program what the Indian Nursing Council has done it. But generally, I used to take a lot of criticism in the Nirman Bhavan. Your nurses are good in theory, but they are lacking in practical. That was the question which repeatedly I used to get. So therefore, this postgraduate, this is a residency program, just like the doctors. So 24/7, they are in the clinical. There is no theory. Only 10% of the time of the syllabus of 2 years you have to spend for this synopsis and research presentations.